Well, we serve a lot of functions. I think, globally, we're acting like a liaison between the neurologist headache community and the primary care headache community. Our name is Front Lines, so that also includes those who are seeing patients on the front lines, like in ERs, advanced practice providers, regardless of the setting. They have their own sections too, and we seek to cross-collaborate with them, but that's the overarching mission. In addition to that, because this section is a blending of the previous primary care section and the in-office patient education section, we're concerned with developing patient education materials, particularly that can be delivered in the in-office setting, and education that can be done as part of the visit. And I think a final thing is the interface between providers and patients themselves. So that frontline barrier and raising awareness and getting patients involved and engaged. What would you like to add?
Well, I would like to emphasize the cross-collaboration with the other subcommittees, such as the underserved population, women's health, pediatrics. We really are a very attached interfacing group with the other subcommittees. So it's a good home base, and that it might be even a jumping off point to other opportunities and other subcommittees. We've been recently newly formed, and so we used to be a group of primary care and then frontline. So right now, our call to arms is to invite our members to begin to come up with where we're going, what direction we're going to take. So as a committee, we're old but new. And so this is a good opportunity in order to really start at the ground floor of building the committee and helping us take a direction as to where we are going to go. Some of the thoughts we've had is surveying our membership to find out what needs they have. And there's also education in terms of how to manage headache disorders in the office.
Things that the previous sections have been doing and are kind of ongoing would include reaching out at national meetings for primary care specialties, particularly family practice. One of our members goes every year to a family practice meeting and really promotes headache education, especially among residents, gives lectures at the meeting on headache every year. That's the kind of thing that we want to broaden the scope of and reach out to more subspecialty meetings, and particularly with trainees, getting them when they're young and getting them invested in headache medicine right from the start. Well, we'd like to create durable materials that will be updated, sort of like living materials for either the online format or in-person delivery format, and again, targeted at broad ranges of audiences, all the way from trainees up through established providers, be they family practice, be they primary care, even OBGYN. Oftentimes they're serving as the primary provider for a woman, and migraine being so common in women, that's a prime target audience. Raising awareness. It's unfortunate that still to this day, so many patients go undiagnosed or are not treated properly. They don't have access to the specialists. So that's another thing that we need to do, is to support the efforts to create more headache providers, particularly headache specialists, and generating interest in trainees to do a headache fellowship. There are 35 fellowship programs, I think, and
right.
Only about less than a dozen applicants to these programs. So there's a huge void that needs to be filled, and I think that we can be part of the instrumental efforts in changing that.